Artificial intelligence refers to the ability of the machines to perform cognitive skills or cognitive tasks like thinking, perceiving, or even learning, problem solving, and decision making, etc. It can help in significant improvement of healthcare outcomes if it's used judiciously. So, since many of us had a lot of dilemmas about the pros and cons of the artificial intelligence in our field, the Vitami core team has made extensive review of up-to-date published literature and statements and other guidelines, particularly focusing on the application of artificial intelligence in our healthcare. So the key issues identified by our teams are like about the privacy issues, maybe, or accountability, and then transparency issues or explainability, if there are any bias or inequalities, security, including cyber security issues, and training and standardization are the other concerns. So to make it into a very simplified manner, also an interesting one, we have putting it in a form of debate today, and two of our core members, Dr. Surya and Dr. Dheemanth.
So as we all know, today we are debating on the topic called as artificial intelligence in the medical profession. And I am putting forth my argument that is artificial intelligence is a boon for medical profession. So to start my argument with a quote, according to Charles Darwin, in his famous quote, he says, "It is not the strongest species which survives, or it is not the most intelligent species which survives, but the species which is ready to adapt to the changes of its nature is the species which survives." So which tries to say that change is the only constant in the nature, and the species which does not adapt to this change will perish forever. So coming to the introduction about my topic. So as we all know, India caters for 1/6 of the world's population, that is around 1.3 billion population. And recently we also saw that it is one of the most populous country in the world. But the sad part is in India, the doctor to patient ratio is only about 0.8 for 1,000 head count of the patients. In contrast, in countries like United Kingdom, it is 2.8. And in countries like China, it is approximately 4. And in Australia, it is 5. So because of this, due to this, we are unable to meet the WHO guidelines, that is the patient to doctor, the ratio which has to be there according to the guidelines. So this is the sad part. So this is where the artificial intelligence comes to the play. That is, catering this deficiency, what we have of the doctors, by this artificial intelligence, and making it easy to cater all this vast 1.3 billion of population, what we have in our country. So let's straight away jump into the role of artificial intelligence in our medical profession. So let me explain this according to the departments, what we run in our medical profession. So first, coming to pathology. In pathology, we all are aware that we see slides, we do diagnosis based on the slides and pictures. By artificial intelligence, by feeding the artificial intelligence machine or app with the artificial intelligence algorithms, it makes it easier for a pathologist or for a general public in the hospital administration for the diagnosis of the pathological slides and other images. So coming to the ophthalmology. So this is a very interesting part and very kind of astonishing use of artificial intelligence in this era. In ophthalmology, as we all know, in diabetes, India is the capital of diabetes, which is not very a positive kind of name what we have got. So there are a lot of diabetic retinopathy cases which are prevalent in our country. So by feeding this diabetic retinopathy fundal images to the artificial intelligence-based algorithm-powered machines, we can do the screening program for artificial intelligence as well as diagnosis program for artificial intelligence, which makes it easier for the management or early diagnosis of diabetic retinopathy cases. So to substantiate this argument, I can give a live example. That is, in Tamil Nadu, with the collaboration of Aravinda High Hospital as well as Shankara Nethralaya, they have come up with a machine which is artificial intelligence powered machine, wherein the diabetic retinopathy screening will be done in a faster way because the thousands and lakhs of diabetic retinopathy positive fundal images have been fed to this algorithm, which makes it easier for screening and diagnosis. So next, coming to dermatology. in this also image-based diagnosis can be done, and especially in case of radiology. So the sad part in our country is, according to the study, there are only 10,000 radiologists in our country, which is very much less when compared for the 1.3 billion of our country's population. But the usage of X-ray, CT, and MRI for diagnostic purposes is widely increasing day by day. So there are many diagnostic centers, but lack of radiologists in our country. So in Tamil Nadu, a e-governance agency is aiding for this, wherein the machines have been created, which are artificial intelligence based powered, wherein it reads the CT reports, X-ray report, MRI reports, it evaluates, it triages, and then shunts the patient for a proper treatment protocol management, which is required in that situation. So this is one of the best example. And coming to the mental health also. So there are few artificial intelligence based apps wherein it has been developed already, wherein by listening to the audio clips of the patient, the call recording audio clips of the patient, subtle cues will be taken care, or subtle cues will be picked up from that audio clippings, and the diagnosis or the symptoms which are positive for the mental health issues will be diagnosed and taken care of. So these are the few departments wherein applications are based. But apart from all this, I want to give a current status quo and a very important application of artificial intelligence, which can be used to prevent epidemics and pandemics like COVID, Ebola, etc., which we have seen in the recent past. So there's a case scenario which has been tried, the pilot program which has been tried in China and other Southeast Asian countries, wherein in a railway station or in a public places, there'll be security cameras. So in that security cameras, using a computer vision as well as infrared radiation, certain medical conditions or symptoms can be picked up. Just for the sake of example, let's consider there's an epidemic which has happened in the particular area wherein the symptom of that epidemic is fever, one of the symptoms. Okay. So using this computer vision and infrared radiations from those security cameras, we can pick up whose temperature is more than 37 degrees or the particular baseline temperature which has been set according to that epidemic. So from this, we can pick those patients, and we can track those patients by using GPS and picture-based analysis and all those things. And we can also find out what is the speed of infectivity which is present in that particular epidemic. So this is artificial intelligence-based epidemic monitoring system which can be used. If we would have known this before the COVID era, we could have tackled this COVID thing in a very good manner, more efficient manner than what we have done in the recent past. And along with that, in case of drug development, in the recent past, we saw Ebola outbreak, and developing the drug will take a lot of time because we have to do phase 1 trial, phase 2 trial, and as well as clinical trial. It has to be approved by FDA and long process. But using this artificial intelligence, we can scan the drug and we can shortlist the drug or narrow down the drug which can be modified for the use of that particular outbreak. So this has been tried, and this was successful in case of Ebola outbreak in the recent past, wherein drugs were shortlisted by artificial intelligence based applications. And apart from all this, when it coming for oncology, in oncology, we can scan the body parts because the genetics and genomics have become an unsolved puzzle till now, because completely all the genetic grassroots have not been touched by our research field yet, but hopefully they will do in future. But in patients where they have a genetic risk of cancer or any other carcinomatous condition, by this artificial intelligence based scan, we can identify any tumors or any oncological conditions in their primitive stages, as well as we can also determine what are the risks which are there for that particular patient from their genetic determinants for developing a cancer. So these are certain artificial intelligence applications which can be widely used and exploited for the betterment of the mankind. So coming to the fallouts of the artificial intelligence. So in India, according to a study, 77% of healthcare professionals, be it doctors, be it ANMs, nurses, or any skilled healthcare professionals, they are deputed in the peripheral areas for the sake of preventive care, giving preventive care and other purposes. But this is a huge number. This 77% is not a less number. It is a huge number. And this can be avoided by bringing this artificial intelligence to the peripheral areas, wherein these 77% of healthcare workers which have been deputed in the peripheral areas can be restructured and can be replaced by the artificial intelligence, and they can be shunted for the curative purposes, which is the core ideology or a core job of a real doctor. And as we also know that in PG residency, in the government institutions or be it in a very renowned private institutions, it is very hectic workload what a PG resident will face. So by bringing this artificial intelligence, we can ease his work or ease her work by doing this, day-to-day monitoring of the patient data or day-to-day how the patient is improving and the blood investigation pictures, which we can see it can be done by artificial intelligence by using a artificial tool called the virtual nurse assistant, which has been developed from this artificial intelligence, which makes them easier. The workload will be burden can be reduced and they can concentrate more upon the curative part and learning more and more part related to their department. So these are a few of the fallouts of artificial intelligence. And coming to the way forward by using this artificial intelligence is mainly this artificial intelligence should be used in a way forward because, as I said, the population is very much in a country like India and doctors, we are facing a shortage. So by replacing this artificial intelligence, we can use this artificial intelligence in an effective way to cater our healthcare needs. And also from this artificial intelligence, we can make this the system very much better because India has recently come up with, in the recent past years, has come up with missions like Make in India mission and Digital India mission. So definitely, and I am saying in a very imperative and very affirmative way that artificial intelligence will support this, the national programs, what we have bringing up in Digital India and Make in India programs, which will make our country to stand better in most of the health indexes, what the international agencies will publish, as well as in case of using of digital tools for healthcare systems as well. Also, we can overhaul our whole healthcare systems for the betterment of the mankind, and we can stand proud in the global list of better healthcare nations. So this is all I wanted to tell about that artificial intelligence is a boon for a medical profession or a medical field. Thank you.
That was an excellent proposition of your side. But now let's listen to the other side about what are the banes of artificial intelligence by Dr. Surya. Over to you.
Good evening to everyone. Thank you for providing me this wonderful opportunity to throw some light on this most upcoming field. So I'm going to speak upon the banes. So firstly, the foremost point I would like to put upon when it comes to banes is regarding the privacy and the security of the patients. So whenever there is an artificial intelligence, there will surely be a third party involved, and artificial intelligence is going to work based on the inputs that you're going to give, the data that you're going to give. So when you're giving the patient information, the health records, all their personal details, it's going to be stored and it's very vulnerable to be easily hacked. And very recently, last month also, we have seen it that AIIMS Delhi, the systems were hacked, and nearly for a week, it took them nearly a week for them to retrieve all the information back. So in the present day scenario, such critical vital information can be used up to any extent to know the genetic predisposability to a disease regarding our country's population and so on and so forth. And when it comes to privacy, some of the patients might not be ready to share their clinical data on a larger basis for any research purposes. So that will be a big downfall. And when it comes to the bias and inequality that's going to happen when we are going to use this information. So when the artificial intelligence is going to be used to make any diagnosis, it is surely going to be based on some algorithm. And for that algorithm, we have to give inputs. So whenever we do study on a population, if the larger the size, the better the outcome. So we are going to have issues with regarding to people giving the permission, and even when we are giving the inputs, if we are not doing the research properly, if there is going to be any bias, if we are only going to do it on a particular population, so the outcome is going to be biased. It's not going to give you a proper outcome if the input is not proper. And when it comes to transferability and explainability, or who is going to be held responsible if something goes wrong. So when these companies are going to make an algorithm, there will be multiple companies coming up with this AI. So they are not going to easily share their algorithm. So here there will be a breach in transparency. They are not going to easily share how the algorithm is done. So we cannot easily, we cannot properly believe in those algorithms unless they reveal it. And when it comes to explainability, for example, if you take robotics. So before robotics, when a surgeon is doing an operation, and if there is any mishap or if there is any complication going to happen, it's going to be the gross negligibility of the surgeon and he'll be held responsible. But when it comes to using a robotic machine, and if there any mistakes happen or if there is any technical glitch, then again there is a question: who's going to be held responsible? Is it the doctor? Is it the hospital which bought that machine? Is it the company that's going to pay for the hefty price? So still these questions are unanswered when it comes to explainability and the onus of responsibility, who is going to take it. And when it comes to the training that is being needed to put in all the inputs, so we know that whenever each human being is so different that some diseases manifest very differently, even when it comes to monozygotic twins. So the information has to be very vast to give you a very close diagnosis. And for this, you know that for a diagnosis to be done, we have to consider the gender, age, the population, the predisposition factors, the risk factors, and even it'll need the uh, clinical evaluation, which cannot be done from anyone else than the humans. So when there are so many factors that has to be given as an input, there can be errors. Ultimately, it will be humans who are going to put the inputs to these algorithms. So again, we can have a lot of errors, and when these errors happen, it's going to be in a very large population. So the errors are going to be on a large population, and the price that we have to pay will be on a larger extent. And when it mainly when coming to training part, we lack in training. For example, digitalization, be it during the COVID vaccination, the few glitches that were there in the app. When it comes compared to other countries, India still has to improve a lot when it comes to digitalization, connectivity. We'll need a lot of better connectivity in the rural areas. And when it and the operator the operator also needs to be very well trained to use all these AIs. And if they're not trained, surely the outcome is going to be completely different. So based on all these things, there are so many loopholes that still have to be covered when it comes to implementation of these artificial intelligence in the treatment aspect of the patients. So I still feel that these can only be a supplement to the doctors, and they can never ever replace a doctor, because the more we use all the technologies, the farther we go from the patients, and there is lack of the human touch, empathy, and emotions, and that's not going to surely let the patient be satisfied in the treatment aspect. So I completely feel that this is can only be a supplement and can help us in a research aspect, but when it comes to treatment aspect, nothing can replace a human. I would like to rest my points.
Okay, very valid points by Dr. Surya. So I have certain questions to both the debaters. Okay, so let's all be in the picture. 1 second. So I have questions for Dr. Dheemanth first.
Yes, sir.
1 second. 1 second. You, Dheemanth. Okay, Dr. Dheemanth, you told all the boons. Okay, it's very essential. It's very useful. You told what all aspects, it's how it's helpful and all. But see,
Correct.
when it comes to the matter of a developing country like India, where there are so many professionals coming up every year, but there is a shortage of jobs, vacancies. So this artificial intelligence will dupe them into further joblessness. That's the main concern everyone feels, especially already in the field of radiology and all. Already the fear among the radiologists is prevailing that AI may take off all our jobs, and that itself will interpret, like you mentioned, and most of them will having a fear of losing their jobs. How do you substantiate about that?
Yes, sir. That's a very good question, and it's a very good question of concern. Actually, it's a need of an hour, which has to be discussed right now. Yes, I agree with your point that many people claim that, most of the departments, like some of the departments, it will get replaced by artificial intelligence, especially like speaking out of radiology, that the people may not get the job, or they may lose the job, or the demand for those radiologists or the role of the radiologist will reduce. I agree with that about this concern. But we can see that in most of the peripheral centers, for example, the place where I am working in a kind of Hobli or Taluka place where I'm doing my 1-year compulsory rural service, there is not even a X-ray technician over there or an X-ray facility over there. Or there is not even, we can't even think of MRI and stuff. There is no USG or there is no X-ray stuff also. So if we have to get an USD for a case of, say, like appendicitis, we have to refer the patient for a district headquarter or a taluk headquarter, which is almost, it costs 20 to 30 kilometers from my place, or some other peripheral places, it is too much as well. So we can say that by this artificial intelligence, bringing this artificial intelligence into the peripheral areas would be a better idea, wherein there is acute shortage of the radiologists in that particular areas, in peripheral centers. So if we not concentrate on the main tier 1 or tier 2 cities also, if we get this X-ray or CT or MRI artificial intelligence based machine to the peripheral center, it will be a great help for those people who are residing in that peripheral areas, wherein all the facilities have not been touched to their grassroots level. So this is how I would like to substantiate my your question. I mean, my argument to your
should
question.
Replace them? Why can't you post very qualified professionals in that CHC or PHC? Because if you put in AI there, first of all, there is no qualified professionals there. You require one more qualified professionals to handle the software or artificial intelligence, whatever is there. So it's adding on to the burden rather than easing your work. Okay, so it may take some more technical experts there. So Surya, how do you tackle this point? See,
Yes,
I have a concern that yes, he's also right in a way that there are acute dearth or shortage for qualified personnel, qualified health professional in, especially in rural setup or in maybe tier 2, tier 3 cities. Okay, there is a disparity among urban setup and rural setup. So in that way, he is telling AI can make it equal. But I feel, what do you feel, Dr. Surya?
Sir, I feel that it is better to use some things like telemedicine, sir. Now we already know that telemedicine is in a very good use, especially when it comes to radiology. Instead of now, if we use AI, who will take the onus if at all the report has an error?
Accountability.
Accountability. Yes, sir. So, but in telemedicine, the radiologist who gives the report will surely take the responsibility. I feel telemedicine is the best way to handle such
even for telemedicine, for example, radiology, he's telling radiology. Even one who knows how to handle the radiology should be there, no? Available in that every center, no? Or how it is possible? Sitting a radiologist sitting in Bangalore, how can he through telemedicine, how can he work in a patient in Ranebennur, Haveri?
No, sir. When it comes to CT and MRI, it is the technician who is helping the patient to get the scan done and the images are being sent. When it comes to ultrasound, even if it is an AI also, someone should be there to move the probe. Ultimately. So whether it is AI is about giving the input, but AI cannot be involved in moving the probe.
Everything on its own.
Yeah. So AI also needs input. The same input we can give it to a radiologist sitting somewhere in
but no. But see, there the training is easy. Moving a probe, you can already give a set in for like codes or formats. Like you have to first hold in this position, next in the next this position, first this maneuver, next this maneuver. If you already have given the inputs accordingly in a set assigned manner, only AI will do the work. Whereas if you train a normal human personnel, then there will be a lot of difficulty in standardization or uniformity in doing the things, or again, person to person, it will become more subjective. Whereas in AI, there is a lot more objectivity. What do you think?
Sir, but as you told, there is change from person to person. There can be a change in the size of, like, for example, if you take scanning the abdomen, again, there will be change in the size of each person. Some people may be obese, some people might be underweight. it will be tough in such cases, no sir.
No, proper
And
see, before implementing anything, there will proper validation will be made by giving enough number of case loads and loading enough number of case loads of all kind of variety. And what I'm asking you is, it's not just AI interpreting. AI will help you to perform the ultrasound, whereas through telemedicine also radiologists can
task better.
this combination of both. What do you think?
Sir, I feel in a country like ours where there is already lot of work shortage, we can train someone how to do the ultrasound procedure and provide them a job also, because to use AI also we have to invest a lot. Government is already not being able to invest in CT machines or MRI machine at taluk level itself. So investing something on AI at PHC or CHC level, instead of that we can
sooner or later it has to come. Means earlier you do it better, no? See, after 10 years also you may have to like get adapted for this. Means it's earlier you start, earlier you invest, or earlier you start training. When the real time comes, you will be on the top, no? If you look at the only brighter side, or if you look at only the positive aspects. So see, I agree with you, Surya. Now I have a question for the Dheemanth. See, what Surya is afraid of is, one concern we are all having is, if you give everything input to the AI, and if it starts taking judgments on its own, like just already happening with humanoids. Have you seen the robots? Like already humanoids, human robot is telling, okay, I want a baby, I want to have a baby, it's telling now. Okay,
with
so
emotions.
similarly, will not this AI also try to dominate over the doctors or the other health professionals, so that there will be total destruction of healthcare professionals by the total dominance of the AI, because nobody can then take a control over it later on?
Yes, sir. It is one of the major concerns these days, what we hear from the critics regarding the artificial intelligence. But I think I just want to answer this question with a good example, wherein just imagine that we have an artificial enhanced algorithm which does the ultrasound or CT scan in some peripheral center. So as we discussed just before, that we can get this ultrasound or any other radiological investigation, for an example, and we can send it for a double, the second verification from actual radiologist as well. That is, as I said, I mean, as my colleague, Dr. Surya was talking about this, that who will be held responsible, who will be held accountable for the report, whatever that AI enhanced machine is giving. So for this, the solution is that we can get it cross-verified or signed by an actual radiologist. So this is how it has been working these days also in many of the government setups, wherein the radiologist will be sitting somewhere in Mumbai or Bangalore or any other cities, and the technician will send the report and he will get it signed. So from this, I would like to say that artificial intelligence can also be leveraged for the welfare of the people, of the peripheral center people, for example, as well as the human interference will also be there.
Less access is there. The patient having not much access to the best of the best healthcare facilities. In such situations, it may be helpful. But Surya, what I feel is, there are already so many human-made errors happening every day. In fact, 2 to 3% of the deaths of the patients just by negligence, or what to say, errors in the prescription writing. Okay, so all this can be avoided using AI. That's what is the thinking now. It can avoid the human-based errors. So, like after that, it will give a standardized format or prescription or whatever it is. Then, like you said, you may include a human also to verify once again, or but utilizing in such for better outcomes, patient outcomes. Won't it help AI?
Yes, sir. In this aspect, I would like to actually agree, sir. For example, now already what we are doing is in e-hospital, we already know this bitter truth that doctors have a very bad handwriting. And what we actually learn during pharmacology regarding the prescription writing is not strictly being followed. It is strictly not being followed. and this is very casually accepted, and even people joke upon doctor's handwriting. So now how they are handling this is in e-hospital, we have to type the prescription and it comes in a very nice printed format. So in these cases and all, yes, I agree that this will be a lot of benefit to the people. But again, if there are errors, who should take the onus? Everywhere it is, if you have to check the errors, again, a doctor should cross-check it. So won't it
Double work. You say
extra investment, and then you're again putting work to the doctor. So you're investing on something which is just going to make the work double. It's not going to reduce the work. You have to again check everything.
Dheemanth, what do you say?
Yes, sir. Actually, it was a nice point what Surya sir told, but I would like to say that it is not double burden. It is actually double verification, which makes it more accountable for the patient, because the work of writing a whole prescription will be decreased, or it will be cut short, so that the work for the doctor will become easy, as well as the doctor will be verifying this artificial intelligence based prescription, what it comes. So it will be a double verification, and it will be ease for the patient, or it will be more accountable and efficient for the patient. I mean, we will be giving a better service by doing this double verification, I feel.
We can increase the number of jobs by appointing 5 doctors for doing the same thing, 5 verifications. So it's a good idea. Okay. No, good. See, thought process, very important. Nice. You'll become a very successful IAS officer for sure. Okay. Having such a mindset. What about the cost burden, Dheemanth? See, it should be made available in all the centers, and the training issues, standardization issues. For a country like India, where the minimum, our budget doesn't have allocation of even 2% for even healthcare. So in such a scenario, such costly softwares or systems, is it very feasible or affordable by all?
Yes, sir. It is a matter of concern, actually, that as you said, that only 2 to 3% of GDP of our country will be invested for the healthcare system. But as far as now is concerned, before rolling out the whole artificial intelligence-based technology in all parts of the country, it is a protocol that first we will do a pilot project. That is, only the selected Apex institutes will be taken, and these projects will be tried in a kind of pilot manner or a demonstrable manner, wherein if the success will be seen in those particular Apex institutes or that particular a model only, then it will be rolled on for the whole country. So I think so in this current situation, or in this current 2023, the scope or thinking about this budget is too far, because we are still in a pilot project level. So we have to do the pilot project, and once if this pilot project is feasible when it comes for economical expenditures, or if it is feasible in doing this accountability for the patient, then only we can roll out and think about the pros and cons regarding the budget, what is required for rolling this out for the whole country. I think so at this current situation, we have not reached yet that what will be the expenditure for installing all this artificial intelligence based machines in the whole country in all the setups.
Yeah. The other side of it is, yes, once everyone starts making these AI systems, okay. So it may be available, just like robots now, robotic surgery. Earlier, only Da Vinci had the issue. So now the 10-year where this thing term is over. Now everyone has got the this authentic this thing to start building robots. So earlier it was costing 10 crores. Now it's affordable at 1 or 2 crores. Similarly, if everyone starts building up these AIs, then it may be available for a lower cost as well.
Yes, like just like I remember before 5-6 years, for 1 GB data, purchasing 1 GB data, it used to cost like 200-300 rupees. But today we are getting it 15, 10, 25 rupees. So maybe.
Yeah. So if considering that, if the government takes up this responsibility and sets up all the AIs in the peripheral centers and all, won't the cost burden to the patients will minimize, Dr. Surya? Okay. So if there is a lot, as we mentioned already, there is a access gap. The patients can't go to the higher center for this thing, or they can't afford to spend their energy, time, money in doing that, and they come at the last moment at the stage 4. All these difficulties or the discrepancies can be minimized by somehow government but even the cost also in the private setup. The cost is also very big matter of concern for the economically deprived section of the people. So if the government takes up this responsibility and installs very high-tech AIs in the rural setups or in the PHCs and CHCs, will it not help the underprivileged?
Sir, surely it's going to help the underprivileged, sir. But when we consider our country, be it whatever technology that comes, the government takes a lot of time to implement it at a rural level. Still, so many taluka hospitals do not have CT or MRI. Only in the district level, now it has come up in most of the districts. Now, when such scenario is considered, the private players are ready to invest on that, and they are not going to provide the facility at a lower cost. And the government, as Dheemanth told, that if the pilot project will work, maybe they might invest. And already taking our GDP to be so low, in spite giving doctors the salary, the government is going to probably look at, okay, we are going to provide another facility to make the job of the doctors easy. Going to be a double check, and it's going to help the doctors. It's going to be a big blow to our budget. They can think it that way. And now, especially, sir, when there is any problem, we have seen that all the government facilities, when they introduce it, when it is being installed, it's in a very good condition. Once there is some damage or there is some issue, we know that there is a lot of big process. The letter has to go to many offices to get it repaired again. And the funds won't be released in time. The company will not come. First time they'll come. Second time they'll be like first to pay the previous repair.
Previous bills.
So all these issues are already, all these issues are already being there present in the Ayushman Bharat scheme that is going on. Where whenever the contract is given to a private player, the payment issues and all such issues are going to be a big problem in reality.
Okay, so I have some serious questions for you. Okay, most of things are agreed here from both sides, but I have some serious issues or concerns about AI, which I should ask Dr. Dheemanth. What about
Yes,
see
sir.
lot of data, lot of personal data is being uploaded to the system. What about my secret personal privacy? I am suffering from some cancer. So if the data gets leaked, everyone will know about that, and I will be mentally upset about that issue. So how to overcome that?
Yes, sir. Actually,
this anytime data can be leaked.
Correct. Correct.
Yes,
sir. It's actually
AIMS website itself got hacked. So similarly, these cyber attacks are malwares are very common, and security issue threats and privacy issues are always a major concern, because lakhs of or crores of patients' data will be there that can be misused in any way.
Yes, sir. Actually, it's a topic of discussion which also happened recently in the Parliament while submitting the IT Amendment Act 2021. Wherein they went to submit this Amendment Act, but it was scrutinized and discussed by Parliamentary Standing Committee, wherein the bill was sent back saying that we have to fix these issues of privacy or data breach or any bias issues what are there in this Amendment Act. So we are looking forward for our policymakers, wherein they'll fix this issue by doing this proper amendment to the IT Act and roll this out again in the Parliament to pass it. So we have to wait till that kind of policymakers come in that and fix these issues.
UPSC preparation, what I learned is the most important, the political will. That's what come in political.
Yes.
First
yes,
point.
sir.
Okay, so political will is the most important, without which.
And also many international agencies are putting pressure, or they have some conventions wherein this IT Amendment Act has to be properly fixed. Those lacunes has to be properly fixed, and then only they can give it, sir. So I think so political will be taken care of from these international pressures.
But okay, political will, all those things I agree. Surya had a serious concern of accountability and explainability. Who will take? See,
yes.
AI has done some screening or some, you told diabetic retinopathy, whatever it is. It has done. But will it take will it be accountable for any errors or any, can it explain why not, or why it is, how it is and all?
Yes, sir. I think I have a way forward for this, like my kind of way forward, what I have thought in my mind. we have seen that recently there was a government policy, the government initiative, that is International Center for Transformative Artificial Intelligence, which was launched by the aegis of Niti Aayog with the collaboration of Tata Institute of Fundamental Research. Wherein with the collaboration, they are bringing out some of the artificial intelligence tools for the healthcare system. I think when contractors or private players or any government institution, just like, for example, if we have set up an artificial, say, ultrasound machine or an MRI machine, so there the radiologist who will be signing the report will be accountable. So if when this age comes wherein this artificial intelligence will be rolled out all over the country, either government will take up the ownership or either they'll be given contract to any private players. So I think so this owners of this particular artificial intelligence based machines, when they will roll out, has to take the accountability so that they will make sure that this any malfunction in this artificial intelligence based system can be fixed time to time properly, so that there'll be no any errors in this. And any kind of medical legal cases can be, if it happens, can be given upon a government or any contract private players who will be owning that particular machine or that establishment per se.
Surya, your views on this? Can it be
Sir, if
that
government
way?
or the company is going, if the government or the company is going to take owners, doctors will be the most happiest persons available, sir. Because in today's situation,
But is it
any
practically
negligence
possible that
going
way?
on?
Is it practically, you are a doctor, you are a surgeon. Now you should make a surgery now. Your entire thing decided decided by the report, USG report there. So AI has done a scan. So will you fully rely on that and proceed with the surgery? And intraoperatively, there is something else is there. Okay. So nothing to do with that pathology at all. Something else. Your incision only completely wrong. Okay. Now how will you? Now you have to put some more incision and do the correct that pathology for say. Now how will you explain to the patients,
Yes,
patient
sir.
attenders, or how will you explain to the AI? Okay, see, you are given the report,
Sir,
but inside there is something else. Patient attenders, can you tell that my computer has given this report, so I did this way? Can you tell that?
No, sir, that is not possible, sir. Ultimately, it will all narrow down to our clinical examination, our assessment of the patient. Whatever we tell regarding the
No, I'm
technology,
telling about the
the first,
accountability. Who will take the accountability? That's what I'm telling.
it,
The government is
sir,
to
the
take.
patients will surely,
He will blame the
sir,
doctor only,
first,
doctor surgeon who did the surgery.
yes, first, the doctor will be beaten, sir.
Hmm.
It's always because
Surya,
we
it's
are
a
the
separate
people, because
session.
we
I
will,
speak.
sir,
Not today. Don't leak out the points
we,
today.
sir, we all know that counseling the patient to undergo a robotic surgery or to undergo any procedure involving AI, it will be the onus on the doctor, because we will be the one who will take the consent. And if anything goes wrong, first they are going to ask the doctors only. And always, we are at the grassroots level, so we will be answerable to the patients. And as doctors, we cannot easily just shrug our shoulders and say that the government has provided us this instrument, and the quality of the instrument is not
Mindset has to
good.
come
We can't.
among all. It's not just the healthcare
Yes.
professionals or some IT professionals. This mindset of using AIs or some technology, this should come. See, now social media, now it has, they're in all common, like all the people are using it. So they know what are the pros and cons of that. So similarly, even the AI also, this mindset using AI should be within among all. Only then this may be very understandable.
Yes.
Dheemanth, what's your
Yes, sir.
thinking about the training and standardization of the AI? Because a lot of the healthcare professionals, as we are very poor in even typing simple things. So when it comes to managing such a high standard software, so a lot of training is required, and also standardization. When it has to make the decision or it has to make diagnosis, means you have to feed it with a lot of data, enough number of data. In a country like India, it's fine. But where somewhere, if you're not getting enough data, and also standardization or validation may be an issue. So how to go about this?
Sir, I think when it comes for the part of the training, I think so. This when this artificial intelligence rolls up all over our healthcare system, this artificial intelligence, the lessons or the training about this artificial intelligence has to be inculcated in our curriculum itself, right from the first year MBBS itself. And when it comes for residency, also we have to make this a part, because just we can see, for example, many colleges offer laparoscopic training for general surgery residents also in few colleges. Just like that, we have to incorporate this artificial intelligence training right from the first year MBBS curriculum itself, so that they will learn the basics through the MBBS, and when they enter their specialty residency also, they will learn the parts which are related to their department, which is related to the artificial intelligence, so that when they come out of their residency or when they come out of the specialty and start actually doing the work, they'll be very much well versed with handling this artificial intelligence, or I can say that they'll be very much tech savvy doctors who can handle all those artificial intelligence stuff, which helps in diagnosis and management of the patient.